So thank you for everybody for joining in. We wanted to take some time. We're just outside of IBS month, but it's still important to talk about these things because we see a lot of people with IBS, and it does affect a lot of people, and we're seeing more and more people coming in. And thankfully, there's a lot of great resources out there, and we work with a lot of clients through IBS. But I think it's really important to outline specific journeys so people can really understand that it is a journey. And hopefully, there's a couple tidbits that people can take from today. We have 3 case studies for you today that are fairly diverse. And I've got a few questions for Nishaat, and I think she has some questions for me too.
Ooh,
and at the end, thank you. And at the end, we'll allow you guys to come on and answer some questions as well. So let's dive in. Okay, case number 1.
All righty, that's me. So case number 1, obviously not a real name, but we'll call her Avocado. So she is a client of mine that I've been seeing for the past year, a 76-year-old female, and she's a retired nurse, has a very busy lifestyle with, a lot of socializing, frequent travel. And so she really came in complaining mainly of constipation, but also the bloating and distension. I think her main concern, I would say, was constipation, and then the bloating and the distension was kind of ongoing for many, many years, and she just needed some relief and some answers. And so her goals were symptom relief, so more frequent bowel movements, not so much straining, and resolving the bloating and the distension as well. And she also wanted to work on more structured eating habits. It's something that she had been wanting to work on for a while, and I guess it was just the right time to get started. So she had previously tried the paleo diet, and she did find that it worked for her temporarily, but it was too restrictive. So, she came in being like, I would like to try the low FODMAP diet. I've heard of it. Just a quick background, low FODMAP diet is basically an elimination diet followed by a reintroduction of specific low sugar foods specific sugar containing foods to figure out what sugars are potential intolerances for some people. So we started with the low FODMAP diet. I also put her on, a little bit of a higher fiber diet than normal because of the constipation. We tried a good quality probiotic. We focused on hydration, and we also did some food and symptom tracking because I always kind of like to get clients started with that in the beginning. So if there are any other triggers too, we can catch them, specifically like non-FODMAP foods as well. So the outcomes of that over about a couple of months were only really 2 trigger foods identified, but her symptoms were much reduced. We found that the probiotic was really what caused that change of events. So symptoms were kind of a little bit better. And then once the probiotic was more consistent at a higher dose, that's when we really saw a change. And then she developed, improved confidence with eating out, traveling, something that was important to her, better understanding of food and emotional triggers. So stress was a big trigger for her. And the importance of structured eating and eating on time and making sure that she's following a schedule, not only for her bowel movements, but also for her energy and her stress and all of that stuff. So the outcomes are, in her own words, a very long journey with IBS is now easier as I understand dietary and emotional triggers. And now I have the confidence to know when and how to manage my symptoms. I would say that some insight to take away from this is that low FODMAP is a diet. It is not a lifestyle, so it's not meant to be long-term. It's a specific amount of time for a specific purpose to figure out what the foods are and then kind of liberate your diet so that you can manage your symptoms, but not feel like you're on a diet forever. So that was kind of my takeaway from her. Lisa, I think you said you had some questions.
Yes, I do. So I took a look at this beforehand and I came up with 3 questions. So we'll start with a couple and then we'll see what timing is like. So first of all, you mentioned paleo.
Yes.
And I personally had quite a few people coming in and saying like they felt better on paleo. Yeah. Some people saying they felt worse on paleo. So what are the pros and cons of paleo, especially when it comes to digestive health?
Yeah, good question. Well, I would say that there are some pros, right? With anything. So it's low in processed sugar, so high sugary foods, high saturated fat foods. It kind of promotes a wide variety of plant-based foods like fruits, vegetables, healthy fats like nuts and seeds and plant-based oils, eggs and other like lean meats, so lean fish, lean meat, good sources of protein. So those are the pros, and that can often be really helpful to those sensitive to gluten and dairy to have those lean protein sources. The cons, however, especially with regards to digestive health, is that it can be low in fiber because essentially you're cutting out like the grains, the starchy veggies, legumes, beans. So those carbs are actually really important. Those fibers are really important to help with bowel movement, to help with the health of the gut microbiome, so the bacteria in the gut. And it's also can be low in calcium if you don't kind of supplement that dairy elimination, and potentially a little bit low in protein because of that dairy elimination as well. So pros and cons, is it, a magical diet for digestive health? No. It's also not something that's meant to be like it is, in some cases people do follow it long term, but that can lead to nutrient deficiencies and things like that.
And that's what I kind of see too, is kind of as this client pointed out, like too restrictive.
Yeah.
On the note of something you just mentioned as well, so we talked about fiber and that paleo could be too restrictive, and this client did come in with some constipation.
Yes.
So why do we tend to see constipation more as we get older?
Yeah, that's a great question. I see that a lot in my older clients. There's a lot of reasons. There's no one reason. Can be kind of a combination of everything or just one thing, but some common things are stress levels, so increased stress levels, lack of fiber in your diet, lack of movement. So as we get older, maybe we move less, and that kind of also slows down the gut. Maybe dental, chewing issues, dentures, that kind of stuff, swallowing problems. So, swallowing problems, the typical treatment is kind of a soft, low fiber diet, which obviously it's easier to swallow, not great for the constipation. And then decreased fluid intake as well, something we see with the older population. So bunch of different reasons, but we do see it more in the elderly.
Okay, so a bit physiological, but some of it just lifestyle.
Yeah.
Kind of related, like our choices.
Yeah.
Very cool. I always wonder what the mechanism there is.
Yeah.
And then also for this client, so there was only like some clients that we go through, they're like, okay, I know like anything with gluten and like they can identify like quite a few trigger foods. This client just had 1 to 2, and I have had some clients that we've kind of gone through, and it seems like, okay, there doesn't seem to be like one trigger food. So what's your take on that when there aren't like, specific trigger foods identified, or there's only a couple? What do you think is going on?
Good question. And I see that maybe in like 20% of my clients as well. And so I would say it's probably twofold. So one is most people, I would say, come in kind of with at least an idea of what their trigger foods might be. And for this client, it was a confirmation, like she knew gluten and dairy bothered her, and doing the whole FODMAP and reintroduction, it was a confirmation of that rather than just being like, oh, maybe dairy, maybe gluten, at least so you confirmed it, right? And then the second thing is we look at what else. So if it's not trigger foods, what else could be contributing to poor gut health? Could it be lack of structured eating? Could it be not enough fiber? Could it be, the gut dysbiosis? Do we need to try a probiotic to improve the gut microbiome? Is it stress? A lot of the times it's stress, or at least that's a big part of it, right? So kind of talking around managing that and seeing if better stress management helps with symptoms. And often we find that it does. So yeah, for some people you don't get, a list of 10 trigger foods, but I think there's still value to doing the process and then kind of seeing what else is next.
I wonder too if there's a bit of a corrective action too, that by doing the low FODMAP, we kind of help digestion. I don't know, a theory.
I see that. I guess I wouldn't say that it's like black and white. It's some people feel like they do low FODMAP, and even though they don't have a ton of trigger foods, they feel better after doing it. I think that's probably an interesting area of ongoing research. Yeah,
we definitely need more research in this area.
Yes.
Okay, I'm going to bring us to our second case study.
Perfect. you. Okay, so case 2, a little bit different. So a younger client, so a 34-year-old female, and she has a very, very busy lifestyle, moderate to high stress levels. She works as an executive assistant, so kind of always working, always on the go, very active. So, lack of activity wasn't an issue here, but she did struggle with portion control and excessive snacking, which could have been possibly contributing to her symptoms. So that's something that she came in kind of aware of and acknowledged that she wanted to work on. Her main symptoms were diarrhea, gas, and bloating. So different from the client before, more diarrhea focused. And her goals were symptom relief, but a big goal of hers was to be able to travel and enjoy eating without worrying where am I going to find a bathroom? Am I going to be in pain? What can I eat? And then a better understanding of her triggers. So for her, it was similar. So low FODMAP diet, we kind of manipulated the types of fibers that she was having because it was diarrhea. We did a probiotic and a prebiotic. We really worked on portion control. This was a big one for her. And also making sure that her meals and snacks were actually nutrient dense so that, she was satisfied, she wasn't getting cravings, she wasn't feeling tired, all of those things. So with her, we saw really, really quick results. So within about, where did we go?
Sorry. There we go.
Within about a month of low FODMAP, she had about 80% symptom resolution. So that's huge. And that's kind of what we aim to get our clients to, but not everyone reaches the 80% so quickly. So that was really a huge win for her. And we identified a bunch of trigger foods, and it was clear with her what her triggers were. She also really improved her eating pattern and balance and structure, and her overall nutrition, like her nutrient intake drastically changed. And a huge win for her was that she was recently able to travel for 3 weeks, eat freely, eat FODMAPs with no issues. So that's something that, in the past she would have been nervous to do. And, she came back from her trip and she said, I had a great time. I ate everything and I was great. So I would say that the insight to take away from this is that, doing the low FODMAP diet, figuring out what your triggers are, taking the probiotic to support you through it can really help you liberate your life. So travel and eat more confidently. I mean, obviously if FODMAPs are your trigger, but in a lot of cases they are. And yeah, so more freedom, I guess, more confidence.
I think we all want confidence and I will take that.
Yeah.
So you mentioned, so kind of like, it sounds like a big goal was to be able to, as you said, like travel freely, be able to eat what you want.
Yes.
And you were able to kind of get to that 80% symptom resolution.
Yeah.
And so it sounds like a big part of her goal was not just symptom resolution, but liberalizing that second stage of the FODMAP diet where we do the reintroduction.
Exactly.
And how do you decide? Like, I know I usually say to clients, like, we're going to follow this anywhere from like 2 to 8 weeks.
Yeah.
How do you decide when it's time to trial reintroduction?
Yeah. So I typically get them to follow it for at least a month, right? So just so they get the time for their symptoms to actually calm down as per their research. So the research shows that, around 3 to 8 weeks is the timeline. And then once they reach about 80% symptom resolution, I feel confident to actually start introducing things, because if they're still kind of at like 50, 60, their symptoms are ongoing, it's really hard to know if their symptoms are caused by a trigger food that they're reintroducing or just ongoing symptoms, right? That just haven't gotten down to that baseline level of 80% resolution. So yeah, it depends how long it takes. Each client's a little bit different, but I typically wait till about 80% symptom resolution before we start trying foods.
I love it. I love what you said, because it does get murky if people don't see it. Like if we're kind of at the 30-40% and they're like, I want to try some new foods, and it's like, well,
not yet.
We don't know. Yeah.
Yeah.
And then do you have any tips if we don't get to that 80%? So clients are doing a really good job with doing the FODMAP, but we're not quite there yet.
Yeah, so it kind of depends where in the timeline we are. If it's not 80% in 2 weeks, I'm not really concerned. If it's not 80% in 4 weeks, we kind of stretch it out. So, we'll kind of stretch it out to about 8 weeks. Sometimes it just takes longer with some people. We don't really know why. It's just how it is. If after 8 weeks, there's really not significant symptom resolution, then I kind of look into their diet a little bit more closely. So do, a proper dietary assessment. Are they maybe having some hidden FODMAPs that they don't know about? Is there something lurking in their supplements, like a sugar alcohol? Looking at kind of the quality of their diet overall, right? Like fiber, protein, fats, carbs. Is that optimal for gut health? And, kind of tweaking those things if not. Also kind of looking at that food and symptom journal. Maybe there's other triggers. Maybe it's not, FODMAPs. Maybe it's something else. So looking at that and trying to see, okay, when are your symptoms the worst? What did you eat a couple of days before that? Sometimes we just need to manipulate the fiber a little bit. That's a big one with digestive health. Sometimes too much causes problems, too little causes problems. And sometimes it's about trying different supplements. Sometimes food is maybe just not enough, and we need to look at, different probiotics, sometimes digestive enzymes to support your digestion a little bit. Sometimes licorice root for inflammation, or peppermint oil for things like gas and bloating. So it really depends kind of what is the main symptom still ongoing and how severe it is. And then if really we try all of those things, stress management, lifestyle modifications, and there's no change, then that's when I'd say, I think maybe it's time to go back to your doctor, do some additional testing, see what else might be going on.
I love the stepwise approach, that it's not like, let's, out of the gates come with the FODMAP and all of these supplements and things. It's like, let's tweak here, tweak there, and get things aligned. And I would totally agree that sometimes it is just looking beyond the FODMAP approach if we're not getting all the way there. And kind of on the topic of that, how big of a role do you see stress management playing in digestive health?
It's huge. I mean, there's so much research to support that too, but we just see it in our practice too. So stress is so closely linked to not only our eating habits, but like also our gut. So, if the brain and the gut are constantly in conversation, and, if there's a disconnect there, or, it's hypersensitive, as we call it, the nerves in the gut, the brain can kind of anticipate that as pain. Or if you're stressed out, that can then make your symptoms worse. So it's kind of this vicious cycle. And sometimes it's really hard to get out of, but it is, I think, a huge and underrated part of gut health management is stress management. So I would highly recommend anyone with gut issues to look into their stress and think about if there's something that can be done there to alleviate some of that. And maybe that'll help.
Yeah, I've totally found that as well.
Yeah.
Some clients, it's like, everybody's a little bit different. Some people, it's not such a big part of it, but some people, it's a really big part of it. Okay, thank you. I will move on to my case that I wanted to discuss. That's a little bit different. Marshmallow, again, would be a really cool name, but not her actual name. So she came to us with IBS symptoms. She was a 61-year-old female receptionist, had really gained a lot of weight since her diagnosis of celiac disease. And she was really thinking, okay, diagnosed with celiac disease, which is a gluten intolerance, cut out gluten from my diet, I should be feeling all better. And she was feeling quite a bit better, but was still having like some instances of severe cramping, diarrhea, bloating. She thought it was because of exposures to gluten. Was trying to think, okay, what did I eat? Maybe, the product said it was gluten-free, but it wasn't gluten-free. Trying to figure out what was going on. And then also the weight gain was something that she didn't enjoy. It was not on purpose. So her goals were to identify the issues or causes. She wanted to know, like, tell me what I'm eating that's causing this. Be able to leave the house without concern. So she wasn't a high stress person, but she was getting a little bit stressed about, like, okay, I don't even want to go out for groceries because, like, I don't know where the bathroom is. I don't know if something's going to come up. And then in addition to that, she did want to focus on losing weight and improving cardiovascular health. And that's something I want to point out too, that that we have people come to us for digestive health, but I think as Nishaat and I have outlined, and I'm outlining here, is like there's so much more. So you're not just digestive health, you might also be weight loss or cardiovascular health, and also we see post-infectious and post-celiac IBS as well. So there can be different layers of it. So I think this is a cool person to bring up. So in terms of our management, the first step was not to go to low FODMAP. The first step was like, okay, let's be super strict on gluten-free. Let's look at, lip gloss that you're using. Let's look at the toaster oven. Let's look at all of these possible places where you might be able to get gluten. And she was really, really good, made sure, she got all new stuff in the kitchen, made it pretty much a gluten-free kitchen, was really into looking at her moisturizing cream, and it got a little bit better, but there was still a lot of digestive discomfort going on. So then we went to the low FODMAP plus a specific probiotic. And then we also did a supplement that had L-glutamine and licorice in it, which can help to support the intestinal lining. And then, so we started with that. We got some pretty good results with that. But still, there was a lot of, and I'm sorry, we talk about poop a lot. There was a lot of things in her poop that shouldn't be there, so undigested food. And also, we got some blood work done that showed her levels of certain nutrients weren't improving post-celiac. So then we did start the multivitamin as well as digestive enzyme. And the digestive enzyme, I typically do wait before starting that with most people to see if we can, because it's a bit of a Band-Aid approach, I think. So see if we can get some resolution without starting that. So Marshmallow is still along her journey. We've really identified some of the key triggers. So no more explosive situations. So things are more under control, more confident to leave the house. We're still doing the lower FODMAP, and we're about to move into the reintroduction. And we've just started, so we recently started some of those new supplements to see if we can get even better symptom control. And then, our next phases, we're going to be looking at reintroduction and that personalization. So how you can eat for the rest of your life. And then a goal of mine is usually to get, if we're on that many supplements, to get clients off of those supplements. Sometimes I find probiotics or for life, but really try to get her off most of those supplements. So some key insights from Marshmallow. So IBS can occur along or because of other digestive issues. So sometimes we do get people who are, had the stomach flu or foodborne illness, and they're like, I don't understand. I should be better by now. And we can have IBS along with celiac disease. We can have IBS along with other diseases as well. And I think it was kind of missed because she presented as celiac disease, so they didn't think about looking at IBS. The cool insights with Marshmallow.
Yeah, I love this case. I think it's so interesting, and it's something that's actually, I don't know about you, but I see this quite a bit too, especially with celiac. So I guess I think you spoke to this a little bit, but my question is, why did you try low FODMAP if this client wasn't diagnosed with IBS? Like, what was kind of the reasoning for that?
Because I know it works. No, that is part of it. I think we had such good success with this cluster of signs and symptoms with low FODMAP, and we've been doing it long enough that we know how to make it a healthy approach. So we're not, putting nutrient deficiency risks on the person. But I think it was just a little bit of a case that it was a bit of a missed diagnosis with IBS because it was thought that it was just related to celiac disease, where I think she probably did have IBS, whether it was because of the celiac disease or, whatever other reason. So to me, the risks involved with doing low FODMAP versus the benefit is definitely the benefit outweighs the risks, and so it's worth doing.
Yeah, I totally agree. And I think I'll have sometimes clients the same kind of situation, not really, proper diagnosis, but it is really something that's, I think, worth trying, because if it works, great. You don't need to kind of resort to anything more severe. And if it doesn't work, at least you tried it and you know that it wasn't really for you, right?
Yeah, totally.
And then what about the other goals, Lisa? So I think you mentioned that she
Right.
wanted to work on weight loss and cardio health, right?
Yes, thank you. I didn't even touch on those. So thank you in terms of the outcomes. So we're working on that now. So in addition to low FODMAP eating, we did work on portions and working on, okay, here are lower FODMAP foods that are actually really good for cardiovascular health. So we're layering that in now as well. At the beginning, it was kind of like, I think that would have been too overwhelming. It was like, let's take it one step at a time. But now we are talking a little bit more about portion sizes as well as specific foods within the low FODMAP categories that are better for cardiovascular health.
I love that.
That is happening. We are working on that now.
Yeah. And it's nice to take, I think sometimes to take that stepwise, because I know a lot of people find low FODMAP to already be overwhelming enough. And then to think about your healthy fats and think about weight and portions. And sometimes it's just not always feasible to do everything, right?
Yeah. Yeah. Totally.
Thank you.
And I know we're kind of getting to the end of the time. I'm going to allow other people. Nishaat, if you have more questions, you're welcome to ask them as well. But I'll allow people to be unmuted if anybody wants to come on and ask any questions. You're welcome to come on. And I can see if there's any comments. Otherwise, Nishaat, if you have any more questions or things you want to add, you are.
I think you answered everything. Do you have anything that you think we can talk about a little bit more?
Well, that's a common question that I get is about supplements and like understanding like which probiotic to take.
Yes.
Yeah. So in terms of, I know our approach is, to me, like probiotics, like saying like, should I take a probiotic is like going to a real estate agent and saying like, hey, I'd like to buy a property. It's like, okay, what for? Is it for you? Is it for renting? Is it, you want 5 bedroom? Do you want 1 bedroom?
Yeah.
And so that's something that I take into account too, is okay, what specific strain has been shown to be in research beneficial for IBS. And then you touched on too some of those kind of calming for the gastrointestinal tract.
Yeah.
I found those.
Sorry, go ahead.
Well, I was going to say that the peppermint.
Yeah, the peppermint oil is an interesting one. I've been using that more with clients, and I know a lot of their gastro doctors are also kind of recommending it a little bit more because the research is good. It's one of those like things that, try it. If it works for you, great. If it doesn't, great. The risks are not that big. I would say probably not really ideal for someone with acid reflux, heartburn. But it is an interesting one, and I do kind of like to try that, especially when there's like cramping and excessive bloating. I think that can help. Again, it really depends on the client. So I think like with supplements also, I would say that not everyone's going to be on the same supplements. It's really about what's the biggest symptom, what's, coming in the way of your life the most. And, I'm talking to your dietitian about that. I think we have a question from Ruth.
Oh, okay.
Yes. So Ruth says, can you have too much probiotics? It's a good question. I think it depends on the type of like the bacterial strain, Lisa. That's what I would say. What like it depends on kind of what the effect of that strain is and what the dose is and how long you're taking it for. Do I recommend everyone blindly taking probiotics lifelong if they don't have symptoms? No. What would be kind of your answer to that?
Yeah, same thing. It totally depends. So the answer, I guess, is yes. Like if you're looking for like yes or no answer, I think you can take too much of anything. With probiotics, like it is one of the safer ones that to go a little bit higher if you need to. But I think like, especially, if you are taking one specific strain, we know that having a diverse gut microflora is really important. Maybe that one strain is going to outpower some of the other ones. So I would say like Yes, you can. But it needs, yeah, I would say talk to a healthcare practitioner if you're worried about that.
For sure. And Ruth also asked, peppermint oil can be almost like having acid reflux. If that happens, is it best to stop? So yes, Ruth, I have seen that happen with, a couple of clients. Some people are just sensitive to it, don't tolerate it too well. And when that's the case, I do get them to just stop. If they want to try it in the future, again, they're welcome to, but I don't really see any point of adding another symptom. And if peppermint oil is maybe causing that, best to stay away. Like we know, like mint, typically if you have acid reflux, that mint is something that can be a trigger. So yeah, that would be my approach. If you react to it, cut it out, maybe try it again in a few months if you need to, and see what happens.
Thank you for those questions, Ruth. I guess I'll wrap it up, and people can always contact us afterwards. You'll have our contact information in just a minute. Some key takeaways. Yeah. Oh, is there another one?
There's one more question. I didn't want to miss it.
Okay.
Yeah. There's a question by Steve. So is it necessary to isolate certain food types one at a time, or is it just a holistic low FODMAP approach when trying to overcome events? It's hard to tell what causes bloating and or diarrhea. Not sure I understand that. Is it necessary to isolate different food types one at a time? All right, Steve, are you referring to the elimination process or the reintroduction process? Because in the elimination process, we cut all the FODMAPs out. Yeah, elimination. So yeah, in the elimination process, we cut everything out at once. And then we reintroduce things one at a time. So one sugar at a time to see what's bothering you and what's not. Because yeah, if we do it stepwise, it just makes the process long. It's kind of confusing. For how long is the elimination? It depends, typically about 4 to 8 weeks.
Yeah. I mentioned 2, and usually I cut it at 2 if people are having not great reactions to it. So that would be the only time that I really do cut it 2. If we're seeing benefit, then we keep going.
Yes.
But yeah, as Nishaat said, I would say we need to do that full elimination and stepwise reintroduction so we can identify things.
Yes.
And that's a part of the personalization step too, is as we go along, not only does the initial stage have to be personalized to an individual, but that reintroduction and the liberalization of the diet. So personalization on so many levels is really key.
Totally agree. Yeah.
So key. I guess, and this speaks to Steve's question too, but we know the low FODMAP diet can be restrictive and nutritionally incomplete if not done with a dietitian. So this is something that we see a lot. People come in who have been doing low FODMAP for like months and are not doing so well on it. And so you really should work with a dietitian or healthcare practitioner with it. So supplements are 2 supplements, not anti, but are 2 supplements. They're not a cure-all. As you mentioned, they're good to layer in, but they are not usually the cure-all. And taking that whole person approach, so looking at not only like, okay, what are the specific foods that you're eating, but what are your other health concerns? What's your lifestyle like? What other things are you doing that could impact gut health? So thanks for touching on that so much, Nishaat, as well. And then, yeah, if people are looking for some more help, I mentioned that course. So I thought I'd put in a link here for Nishaat's course on gut health fundamentals. It's a really good place to start if you're looking to optimize your gut health. And then if you are looking for one-on-one counseling, you're welcome to go to our website, and there's links on there that you can book in. Or contact us. All of our contact information is on there. You'll also see it's been on the banner at the bottom, our toll-free number and our email, support@nutribocan.ca. Thank you, Nishaat, so much. I love doing these things with you. I learned so much every time.
Thank you, everyone, for joining us. It was really nice to have you all, and hope to talk to some of you soon in the future.
Okay, thanks.
Bye, everyone.